Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Welcome to the AMSET session at 2020 ISNA convention. Before I introduce our speakers today, I'd like to say a few words about AMSET. AMSET stands for Association of Muslim Scientists, Engineers, and Technology Professionals. It was established in 1969. It celebrated its 50th anniversary in 2019. This is one of the main activities of AMSET to gather speakers and specialists in certain areas of science and technology and have them speak at the convention. But we also have started recently a webinar series on science and technology that started airing last month and will continue on a monthly basis. So we'll talk briefly about that. So I'd like to share the screen and show a few things, few information about AMSET. So it was, as you have mentioned, it is a non-profit organization registered in Indiana. Website is www.amsetweb.net. We also have the LinkedIn page, as mentioned here, and also you can find membership information on our page. I'm the current president. My name is Sohail Anwar of AMSET, and Vice President is Professor Tahir Saif. Secretary is Mr. Rashid Rabbi, and Treasurer Muhammad Asad. And Brother Rashid is in charge of the web page, and Brother Asad is in charge of the carrier session and fair. So what is the purpose of AMSET as an organization? So we provide guidance and assistance to AMSET professionals as well as students in their education and careers. And also overall, our goal is to bring the awareness of science and technology amongst the Muslim population within the US and North America. We also try to enhance networking amongst the professionals and businesses and improve the distribution and dissemination of technical knowledge and Islamic knowledge as well. It also serves as a platform for Islamic scholars to deal with or analyze the ethical implication of technological developments. Also advocate for public policies based on responsible use of science and technology. We promote activities that are scientific, educational, religious, cultural, and charitable. Also, we help Islamic schools, help Masajid in their educational programs. Some of the ethical issues that may arise out of science and technology research, such as 3D bioprinting tissues and organs, are they safe and ethical from an Islamic perspective to implant on patients? And also technology, climate change, human evolution, AI, and there are many ethical issues that may arise out of that, and what is the Islamic stand on that? That are some of the things we try to analyze and present in conferences or papers. We have some of the other activities that we have done are related to career fair networking sessions so that our graduates can obtain jobs in their relevant industry. These are some of the snapshots from prior ISNA sessions. In 2017, we had talks on intelligent biological machines and sensors by university professors from Purdue and University of Illinois Urbana-Champaign. In 2018, we had talks on nanotechnology and cybersecurity from experts. In 2019, we had talks on the environment and how to make masjid more green. And there is a picture of an entrepreneur of Taiwanese origin who is a Muslim, and he was really appreciative of this session. So membership information, we encourage you to become a member. Well, it's $30 a year. You can find membership information at the website. Become a member, establish AMSET chapter in your city or area, establish discussion groups, as well as help become a mentor at college and high school level to help students. And we can help you with that. Please contact me or any of the executive committee members. So with that, I come to today's session. The session theme is Muslim scientist perspective on the spreading of the novel coronavirus. Our first speaker is Professor Tahir Saif, who will talk about COVID-19 and homemade mask. There's a shortage of it, and we'll analyze how effective the homemade mask could be. Second speaker is Dr. Amber Nahal, who is a medical doctor, also have MPH, whose topic is what to do with to prevent COVID-19 spread as per science and your duty as a Muslim neighbor. And lastly, we have Santi Alexander from Eli Lilly and Company. Eli Lilly and Company also is working to develop a vaccine for COVID-19, but her talk is going to focus on mainly the carriers at Lilly, how our professionals can connect with the recruiters at Lilly and find a position there. So I hope that you will enjoy this talk. And if you have any questions, please let us know, any of the executive committee members, or put a comment on the comment box, or contact us from our website, and we'll get your questions to the right person who are speaking today. Again, thank you very much. I hope that you enjoy our talks, and please provide our feedback. And with that, I will hand it over to our first speaker, Professor Tahir Saif. Thank you so much.
Assalamu alaikum. This is Tahir Saif, University of Illinois at Urbana-Champaign. I will talk about one aspect of COVID, which is the use of mask and how does mask or can mask help at all, particularly when it is made at home using home cloths. I will share my screen so that I can make the presentation to you. I will now start sharing the screen. So I hope you can see my screen. So does home mask help? First of all, let's see where we are in COVID and what has happened to the world. If you look back for a few months back, we recall that December 12th was one of the earliest times of COVID-19. First patient was hospitalized in Wuhan city in China. And then by December 21, WHO in China, the World Health Organization in China, was informed of the cases, of the new cases of this pneumonia of unknown origin. And then December 31, a total of 43 cases of Wuhan, 33 cases of the patients were detected. And the outbreak was associated with exposures to one of the sea markets in Wuhan city. By January 7th, a new type of coronavirus was identified, and RNA sequencing was completed and sent to Nature for its publication. By January 20, 282 confirmed cases of COVID was detected in China, in 4 countries at that time: China, Thailand, Japan, and South Korea. So that was late last year, early this year. Let's see what has happened today. Well, until I'm recording this little talk, this is August 15, 2020. Globally, we have about 21 million cases being identified and about 755,000 deaths. In the US, we have more than 11 million cases being detected and more than 400,000 already being dead. So the disease has gone worldwide, and the colors show here the number of people infected just in the last 1 week. That is, would be about August 7th to August 15th. The countries with more than 100,000 people being identified are shown with darkest brown. So you see Brazil here, United States, India, and a few other countries. But nevertheless, the numbers are extremely large. Even the little less brown is 10,000 to 100,000. And again, most of the world is going through a significant rate of infection as they're being identified by the tests. Now, coronavirus is not a new disease. It has been identified for quite some time in 1930s. And the disease was first recognized in humans. It used to be called HCoV-229E, and it was isolated in 1965. And then there were a few other variations, as you can see the names here. 2003, it became much more severe because of the respiratory problems it would cause. It got the name Severe Acute Respiratory Syndrome Coronavirus, or SARS-CoV. Now it's more known as SARS-CoV-1, which was 2003. But then 2009, 2003 was the SARS, the coronavirus with the severe acute respiratory syndrome came. But then in 2012 came the MERS, which was mostly in Middle Eastern region. And of course, 2019, we are faced with COVID-19, which is now known as SARS-CoV-2. So the disease has a long history and it's progressing in different forms. So how does it work? The coronavirus is a small virus particle. It's about 120 to 160 nanometers in diameter. And it has an RNA inside, and it has some proteins which are known as spike proteins, which they use to infect the cells inside the respiratory system. And I'll show you next. So the spike protein comes and binds with what is known as ACE2 receptors, the angiotensin converting enzyme 2 receptors, ACE2 receptors. They're found in many different types of cells, one being the epithelial cells of the respiratory system. And once that binding happens, then this virus can enter the cells and then begin to multiply and then release this, and then get released from the cell and begin to infect the other cells. So the process progresses at a rather rapid rate. So how does it go from one patient to the healthy people? What we know now is that one of the major routes of this transmission is when someone sneezes or coughs or talks, then we release a lot of droplets. And these droplets can vary at various sizes. Below 5 micrometers is what we typically known as aerosolized droplets, and above 5 micrometers is known as the droplets. So until today, it is believed that a large portion of the sneezing, coughing, or talking droplets are above 5 microns, and they begin to disseminate from the individual, as you can see in this image. And this was taken at different times. And by about 0.3 seconds or 340 milliseconds, you see the droplets have reached about 75 centimeters, quite far from the individual who is sneezing in this case. So these droplets carry those viruses, and once they are inhaled by a healthy individual, the healthy individual gets infected. So the question is now, can mask help in stopping the dissemination from the patient who is sneezing, coughing, or talking? Now, for coronavirus, for COVID-19, it is found that a large number of patients, infected patients, are asymptomatic or pre-symptomatic. In other words, the asymptomatic patients do not have any symptoms, but they can spread the disease. Pre-symptomatics are the one for whom the symptoms will show up in about a few days, 4, 5, 6 days, during which they can spread the disease. And some of them are super spreaders, a word which means that they can infect many people. So because we don't know who is infected, who is not, everybody has been asked to wear mask to prevent the spreading of the disease. But if everybody has to wear masks, then masks would not be available, enough masks would not be available, and they should be preserved for the healthcare providers. So the commercial masks. So the question is, what else do we have to prevent the spreading of the disease? And hence comes the question that can homemade mask help? But before that, can any mask, for example, a surgical mask, can surgical mask help? So a recent study shows that surgical masks or medical masks commercially available. These are not N95 respirators, so they're the commercial medical masks that are available in the markets. If an infected patient wears them, then after the infected person's coughing or talking, it is found that for the coronavirus, with the mask, when the droplet size is larger than 5 micrometers, then the collected number of virus goes to almost zero. Now, if you do not have a mask, then of course you get a lot of virus outside. So which means that the masks prevent a lot of virus from being released or collected in some petri dishes. In other words, the surgical mask significantly reduces the spreading of the disease. And the question now is, can homemade mask help in the same way, or to what extent can this help? So what we did is we took a wide variety of home cloths and also the surgical masks that I have been referring so far. These are the surgical masks or medical masks. So we compared 11 different cloths. Some are t-shirts, some are used t-shirt, new t-shirt, regular fabrics, 100% cotton to 100% polyester or some combinations of them, as well as silk. And we wanted to find out how these cloths would be effective in blocking the droplets carrying the virus type particles. So the experiment is quite simple. So we take an inhaler, regular inhaler that people use for asthma type of problems. And we can fill the inhaler's nozzle somewhere here with a small droplet of distilled water with 100 nanometer fluorescent particles. So these are small particles that are not virus, but they are of the same size as the virus, but they're fluorescently labeled, so you can see them when appropriate light is shined on them. So what we do is we press the inhaler, and that releases small droplets of the size that are similar to that of the coughing or sneezing. And these droplets come with high velocity, similar to that of coughing and sneezing. And they hit upon a cloth, which is the home cloth, which is the cloth that we are trying to understand whether it will help if it is used as a mask. And what we do is we look at what fraction of the droplet volume that goes through the cloth and gets collected in the dish behind it. And I will show you some videos. As we carry out this experiment, we also video record it with a high-speed camera that you can see here. And conceptually, this is the inhaler. It's releasing droplets with high speed, and the droplets are carrying small particles, nanoparticles, same size as the virus particles. They're hitting the cloth, which is the green line here. Some of the droplets are being stopped by the cloth, and some of them go through. So we collect them in a petri dish. So because they have the small particles inside, so if you look at the petri dish, these small droplets get collected behind, and then we just need to count the nanoparticles in the dish, and then we can compare when there is a cloth and when there is no cloth. So if you have no cloth, then there will be fewer particles that we can count. If there is no cloth, if there is a cloth, then there will be fewer particles in the petri dish, and with the cloth, without the cloth, there will be a lot more. And all we do is you just take the ratio of the two numbers. So if there is no nanoparticles being found with the cloth, then its efficiency would be 100%. Otherwise, its efficiency will go down. So then we compare the efficiencies with respect to the surgical mask. So first, let's see in a video that is played slowly here. And what you will see is the nozzle, from the nozzle will come out the droplets. And this is just a one layer of t-shirt. So you might have noticed that when the droplets come out, some of the droplets go through the one layer of t-shirt. And those droplets carry those nanoparticles, and hence it would be the virus particles going through the cloth. If I take 2 layers of t-shirt, then you see not many droplets go through, just a few droplets go through. So the 2 layers provides a lot of droplet blocking efficiency. Now, this is to represent the 2 experiments that I just showed you would be someone sneezing onto a mask. But if someone is some distance away and those droplets are coming to the individual, to the healthy person, how good is the mask? Here is just one layer of t-shirt. And here you will see the droplets have become much smaller because they are coming from a distance. And I will fast forward a little bit so that you can see the droplets coming, and you might be able to see this tiny droplets coming and hitting the mask cloth, but nothing is going through. In this case, we cannot identify much at all. So this would mean the individual wearing a mask to protect himself or herself from somebody who is releasing the droplets. So in either case, if you have a one layer cloth or two layer cloth, then 2 layer t-shirt cloth, a good part of the droplets can be captured. And if you're far away, even 1 layer cloth is quite good in preventing the droplets from getting in. This is the case with the medical mask. So here, similar droplets are coming in, and again, a few of the small droplets can go through, and they can spread the disease nearby, but a lot fewer than if there is no mask at all. So if you look at the actual numbers, there are these 11 fabrics, and I will not go through all of them. I will just notice that fabric number 6, which is a t-shirt, a new t-shirt cloth, and we tested quite a few of them, and the median value somewhere you see around 80% of the droplet volume is picked up or blocked by the 1 layer of t-shirt fabric. This is the blockage of the medical mask, is close to 96%. Now, if we take 2 layers of fabric 6, and that's what is shown here, if we have 2 layers of fabric 6, then this ratio of 80% efficiency now becomes close to 94% or 95%. And if it is yeah, I guess if it's 3 layers, I think there's something wrong here. The bottom line is if it is more than 1 layer, the amount of the fraction of the droplet blocking significantly reduces or significantly increases and it becomes somewhat closer to the medical mask. So now the question is, okay, so we have the 2 layer t-shirt cloth that provides a good resistance against the droplet release, but is it good enough for breathing? Because for any mask, what we need is a good breathability. So you want to have a mask such that we can comfortably wear it and the air can go through the mask. If it is not breathable, then a majority of the air will go to the side of the mask, which is not good, because a good fraction of the droplets will go out by the side of the mask. Or when we inhale, if it is difficult to inhale through the fabric, then the air will come from the sides, and somebody sick around us will have the droplets going through the sides. So what you want is a fabric that gives us a good breathability, so that the air actually goes through the cloth, not by the side of the cloth, and yet it provides good blocking efficiency. So what you have seen here is a 2-layer t-shirt cloth gives good resistance against droplet, against blocking the droplet. But then the question is, how good is it to breathe through? So the next slide will show you how we measure the breathability. So this is a tube through which we force air, and this is the cloth which blocks the air, and we measure how much pressure we need to flow a certain amount of fluid, a certain amount of air to the cloth, and that gives the measure of breathability. So I'll show you the relative breathabilities between different cloths as well as a medical mask. So here, the medical mask has a breathability of about 2. The units are a little bit unusual. It's millimeter per Pascal second. So it's about 2. And if you look at fabric number 6, with one layer, it has a high breathability. It's about 8 compared to 2, which is medical mask. It's 4 times more breathable. But we have seen that if it is a 1 layer, yes, it's very breathable, but it is not so good. It's about 80% blocking efficiency, median value of the blocking efficiency of the droplets, high velocity droplets. But with 2 layers of fabric 6, its breathability has gone down to about 4, which is expected, but still twice compared to medical mask. So with 2 layers of t-shirt fabric, we have more or less the same blocking efficiency of the droplets as that of the surgical mask, as you have seen before, but it gives twice the breathability as the surgical mask. So obviously it will be much easier to breathe through and more comfortable to wear. Of course, with 3 layers, the blocking efficiency becomes more or less the same as the medical mask, but its breathability has gone down. It's probably about 3 or so. Yeah, it's about 3. So it's still more breathable than the medical mask. But with 2 layers, it gives us about 95% or 93% efficiency of blocking the droplets, and it gives you twice the breathability at medical mask, so it's much more comfortable to wear. And more importantly, these cloths can be washed by the end of the day or half the day, depending on your comfort level and how much it has got soaked because of the sweat or because of the coughing, sneezing, and talking. And it can be reused. So if you have 2 or 3 of these masks, you can change them a couple of times a day. In contrast to medical masks, which are much more difficult to breathe through, but they have to be disposed. You cannot use it or wash it. So they add a lot more burden on the environment. If 300 million people in the US use masks, and if they have to discard the medical mask every day, then that would be an enormous burden on the environment because they're not biodegradable. Whereas a t-shirt cloth mask can be washed, it's biodegradable. You can use one for the whole month, or you make 2 or 3 of them, and they can last for a long time, just like we wear a t-shirt for a long time. So both environmental friendly, and it gives a similar blocking efficiency as that of the medical mask with 2 layers. So how does it work? So we have spent some time on this one. The main mechanism is that when you use first 1 layer, then the high-speed droplet comes, and some of the droplets can just push through the cloth because of the high momentum, and they come up with, they become smaller, and they begin to get spreaded. But if you have 2 layers, then what happens is the first layer allows some of the droplets to go through, but the velocity of the droplets coming out from the first layer becomes significantly less, and hence it's much easier for the second layer to capture the rest of the low velocity droplets, and hence the net efficiency of blocking the droplet increases significantly. So even though the first layer may have a median blocking efficiency of about 80%, with 2 layers, the blocking efficiency increases to about 93, 94%. And whatever is remaining in terms of the droplets, they are captured by the cloth, and they get soaked by the cloth. So they're trapped and soaked. In contrast to medical mask, they would not be soaked. Medical mask is hydrophobic. There is no soaking ability. So it may just run down. It has a higher blocking efficiency, slightly higher blocking efficiency compared to the 2-layer t-shirt cloth, but it just runs down after it runs down or evaporates after they're being blocked. So that's the main mechanism. Is the first layer blocks some of the droplets, allows some of the droplets to go through, but takes away most of the momentum, most of the velocity. The second layer of the t-shirt receives the low velocity droplets and is able to capture most of it. The net efficiency is significantly higher. I'll skip this part and also skip this one. So in summary, COVID-19 is widely spread by asymptomatic and pre-symptomatic individuals. So masks should be used by all. So you can, it's a source control process. And home cloth coverings are highly effective against this droplet transmission. But using mask is not the only way. It should be part of the overall strategy, which is using face coverings, social distancing, keeping distance apart from one another. We need to do the testing and contact tracing and isolation, all put together, provide a good strategy in prevention of the disease. So with that, I will stop sharing and thank you for listening. And if you have any questions, you can email me. My email address is my last name, Saif, S for Sam, AIF for Frank, at Illinois, the state Illinois.edu. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum. My name's Dr. Ambreen Nahal. I'm a pediatrician and I'm a former medical director for the Massachusetts Public Health Agency, Mass Health, as well as a former chief medical officer in New York City for 14 centers. As you can see behind me in this Zoom background, I'm currently at MIT as a Sloan Fellow in the Sloan School of Management. And I'm presenting today on behalf of ISNA, as well as AMSET, or the Association for Muslim Professionals for Science, Engineering, and Technology. So I just bear with me very quickly while I share my screen. And then, so what to do to prevent COVID-19 spread as per science, and what is your duty as a Muslim neighbor? Bismillahirrahmanirrahim. I have no conflicts of interest to disclose. What are our objectives today? To learn the basics of coronavirus, to understand spread and how to prevent it, be empowered to protect your family and your community, serve as a good role model, as all Muslims should always do, become a source of spread of factual and science-based information, and learn how to find up-to-date information yourself. So the reason I'm doing this as a slide presentation, and the reason I'm going to show you some videos from HHS, or Health and Human Services, as well as the CDC, is so that you can yourself go directly to the source and get the information, because we should always be empowered with knowledge. What is COVID-19? It's the name of the disease caused by a novel or new coronavirus. It is in a similar family of viruses that cause a common cold, or coronaviruses. And corona comes from the, describes the crown of spikes on the surface. It's considered an RNA virus, and this describes the type of genetic material inside. It's considered to have mutated, the genetic material mutated or changed its genetic sequence to jump from animals to humans. And this is why it has caused a pandemic, because our bodies have not seen this before. And it can cause very severe reactions in some people, and other people may not have any symptoms, but are able to pass on the virus. So that's why social distancing is so important, because not everybody knows if they have the virus, but it can be spread very easily, like the common cold. Can be spread person to person via mouth and nose secretions through coughing, sneezing, talking, or singing. So to pause for a second, it's It's very important to think about this because our communities often have very large weddings where there might be singing. And that singing can actually be the cause of spread, as happened in South Korea in certain churches, where one person could infect dozens of other people. And we have to be very careful about this. So I would recommend that really it's best to avoid weddings, even though that's very hard to do. But this is really, we're in an emergency situation. It's rarely spread by fecal route, so it's not typically a problem through food or dirty water. It can be spread by surfaces that are contaminated, so it's often because you touched your eye or your nose or your mouth with hands that you've used to touch something else. Wearing a mask, hand washing, and physical distancing are important to prevent spread. And hand washing should be for at least 20 seconds, and you should make sure that you cover all parts of your hands in doing so. Physical distancing is recommended to be at least 2 meters or 6 feet apart from other people, and we'll go over this in a little bit more detail shortly. When possible, do your task from home or online, whether it's banking or bill pay or shopping. Avoid large crowds and consider using telehealth or online health resources, particularly for those who are elderly or have chronic illnesses. For some specifics on groceries, minimize your trips to the store. When you pick up an item, only pick up the one that you plan to purchase, not just picking up and then putting it down. Bring your 60% hand sanitizer along with you and use it when you're leaving the grocery store, certainly when you get in your car. Wash your hands, again, washing, making sure that you get everything, get your thumbs, wash your hands thoroughly. And I'm doing it too fast right now, but make sure you cover all parts of your hand. So wash your hands when you get home. Spread from food is very unlikely, so you don't need to go through any elaborate cleaning of surfaces or food, but do wash your hands again when you put your food away. If you want to wipe everything down, that's fine. And some people will leave groceries that are not perishable in the garage for 3 days just to be extra safe. And I think there's no harm in doing that, but just be aware that it's not considered necessary. For cleaning, again, we don't know how long it stays on surfaces. Yes, it is safer generally to clean surfaces very frequently. You should use a type of cleaning product that is appropriate for the surface. But if you don't have a specific cleaning product, you can use a bleach solution of 1/3 cup per 1 gallon of water on hard surfaces. Please don't use something intended for hard surfaces on something like cardboard, especially for food items. Clean doorknobs frequently because this is touched all the time. Use gloves to protect your hands when cleaning from chemicals. Clean your cell phone or just avoid using it when you're out. And when you're, some people will shake their laundry, but don't do that because it may disperse the virus. For telehealth, this is a really great video.
The COVID-19 pandemic is altering almost all aspects of American life. During this emergency, we've seen a dramatic rise in the use of telehealth. Hi, I'm United States Surgeon General Dr. Jerome Adams, and here are 5 things to know about telehealth services. First, telehealth visits are safe. Virtual appointments lower the risk of spreading the virus among both the general population and healthcare teams. Second, telehealth enables those who are vulnerable to the coronavirus, like the elderly and those with compromised immune systems, to continue receiving some medical care safely and without office visits. Third, Medicare allows payments for telehealth services for beneficiaries wherever they are, even in their own homes. Prior to the COVID-19 public health emergency.
So I'm going to stop there, but please be sure to consider this as an option, especially for those who need to have their medications filled frequently, as well as anybody who has chronic health illnesses that might need to avoid in-person contact. But do make sure that you check that it is covered by your insurance. Vaccination. Before we get into the specific vaccination, please, please, please do not forget to keep up with your regular vaccinations for your children, because that is extremely important to maintain, because those diseases still need to be protected against, like measles and mumps, and pertussis and things like that. The flu shot is recommended. The season is coming up again, especially for those with asthma or chronic health conditions. Vaccine trials for the specific virus are underway, and we do consider them to be reliable, and it should be fine to get the virus when it's available, regardless of should be fine to get the vaccine when it's available. And, in general, for any vaccine, it's more effective if more people get it. So we always recommend getting vaccines for public health. This is a quick overview, but I think the video will show it better. Wash your hands first before putting on your mask. Put on the mask over your ears. Cover your nose and your chin. Then you can go out and exercise. Bring along 60% alcohol so you can clean your hands frequently. And if you encounter somebody, stay 6 feet away. Protect each other. Okay? If somebody is infected and tests positive, they should stay in a separate room of the house, use a separate bathroom if possible, and if not possible, then the bathroom should be cleaned thoroughly after every use. All the surfaces should be cleaned. Avoid having shared meals or being in the same room. And if 2 people must be in the same room and one person's been infected, then that person should wear a mask, the infected person. And after 10 days and 24 hours without fever, it is considered safe to be around other people again. What is the difference between quarantine and isolation? Quarantine is when you might have been exposed to somebody. So maybe you were on an airplane, or maybe you went to visit a clinic for an appointment. You may want to stay away because you might have exposure even though you don't have symptoms. In comparison, if you test positive, then you should isolate. So it's not necessarily that different, but it is about just differentiating between who is maybe exposed as opposed to definitively infected. Being physically distanced does not need to mean isolation. Consider virtual celebrations through Zoom or WhatsApp. Arrange to maybe exercise together, whether it is actually exercising together, physically distanced, or maybe just set a time and be on the phone and go for a run together or walk together. You can do virtual cooking classes or art classes, or you could do it, either like sign up for one, or you could maybe even, learn from your grandmother via Zoom or WhatsApp or FaceTime, in order, to learn to like kind of quote cook together. There are lots of online games. Mental health is extremely important because pandemics are stressful and they disrupt your normal patterns and habits. So even the most resilient and tough person might be struggling right now, and there is no shame in that. It's important to take care of your physical, mental, and spiritual health as one continuum. It's a good opportunity to perfect your prayers at home. Monitor your sleep and appetite patterns, as this is an indicator of many types of mental health issues. So if you find yourself unable to sleep, or you just want to sleep all the time, do consider whether that means that there's something going on that is an excessive stress. And admitting that you're experiencing this stress and getting mental help is absolutely allowed in Islam. There is no deficiency in your faith if you were to do that. Allah subhanahu wa ta'ala has, as a blessing and a benefit, has given us this resource that we can take care of ourselves. And there are several hadiths that say that, of all the types of blessings, our health and our time are the two that we waste and we don't appreciate, and that Allah subhanahu wa ta'ala does want us to take care of all of ourselves. This is a way to take care of yourself, particularly if you're elderly. This is a particular program for elderly people at home.
Hi, welcome to Go for Life, an exercise campaign from the National Institute on Aging at NIH. My name is Sandy McGrath. I'm a personal trainer and fitness instructor. We're going to do a sample workout.
So I just want to pass
even if you just lift just ever so slightly, it's a good thing. So we're going to do 10 of these and take it out. So we're working the backs of the arm.
So as you can see, they're using a chair. So it's very friendly to people who might have some limitation. And there are many of these videos for free available online. Take care of your community, your elders, anybody who's elderly who might have a disability. Consider arranging grocery services for them, or create a volunteer team who can go get groceries once and distribute it to many people. Share informational videos and have pro-social behavior and encourage that in others. So follow the instructions here as well as in other credible places. Set a good example for other people. As far as social justice, it is immigrant, minority, and low-income communities that are most affected by COVID-19, which aligns with the inequity that's called social determinants of health, or what kind of housing and transportation do you have? What kind of job opportunities do you have? Being able to work from home is a privilege, and so those of us who can avoid exposure should be grateful for that and give our blessings, but consider those who don't have that option. Small businesses have particularly been hard hit and do need to be very careful about maintaining safe distances while operating their business. And if you are a patron of a business, please consider giving a donation or helping them with their online services, just so that we can be very fiscally responsible on behalf of other people in our community. There's been an increase in xenophobia or fear of foreign people, and even though many of us may have been born in the United States, there is still a perception that we are foreign. And when there's fear, particularly fear of a virus, there can be increase in xenophobia. There is a very wrong and false use of term China virus. I'm only saying it here just to identify it. It is not correct. We should always use scientific terms. We should not associate any one race or people with the virus. This could have happened anywhere, and it is now spread throughout the world. So please, please, please do not use incorrect terminology and be respectful. Be generous and be kind, and everybody is suffering, particularly to those who are delivering things to you. People who are in the grocery store working there, they are literally risking their lives to serve you. So please be kind to them. This is a resource in Urdu from the Australian government, but the virus is the same all over the world.
अपनी कम्युनिटी में कोरोना वायरस के फैलाव को रोकने के लिए हम सबको अपना किरदार अदा करना है.
I won't show you the long video, but there are resources like this on the web. And this is one for Somali from a refugee clinic.
Hi, my name is Dr. Michael Doe. I'm a pediatrician with the Valleywise Health Pediatric Refugee Clinic. I'm here to share an important message with you about COVID-19, also known as the coronavirus infection. To tell you more about that, we have Olia.
COVID-19 oo loo yaqaano coronavirus waa cudur neef-mareenka ku dhaca oo ku dhacay
It's got
ka caadiga
thorough
ah ama
information.
xanuun haddii caruurtaada aysan tegayn iskuulka
including how to
biyo
wash
iyo
your
saabuun
hands
si joogto
properly.
ah mar kasto aad
So consider ways that you can support your community and find them valid pieces of information, and be sure to share only information that comes from health sources like this: the CDC, the WHO, IMANA, Islamic Medical Association North America, ISNA, local state and state departments, your Department of Public Health, doctor's office. But please, 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 as Muslims, we have always been very pro-science. We've been a source of truth and justice. It is extremely important that we continue to do so. We should encourage each other to be the best of mankind, and to put our community's safety and well-being and our families' safety and well-being ahead of any personal interest or desire to have fun. Inshallah, we will again be able to live life in our normal manner. And I think if we can be creative, we can find ways to still live life and connect with each other and celebrate each other while also being safe and respectful and taking care of each other. Thank you so much for your time. And I really appreciate your taking the time to listen. Jazakallah khair.
Good afternoon, everyone. My name is Santi Alexander, Diversity Talent Scout, and I'm excited to be here at this virtual event. I want to first of all say thank you to Association of Muslim Scientists Engineers for inviting me to come and share with you some information about Lilly, job opportunities, and about the employee resource groups here at Lilly. On the agenda today, we will talk about Lilly, job opportunities, and the employee resource groups. Lilly is headquartered in Indianapolis, Indiana. We have operations around the world, including manufacturing in 13 countries. We have more than 9,000 employees doing cutting-edge science in Indianapolis and in San Diego, California, Cambridge, Massachusetts, as well as China, the United Kingdom, Spain, and other countries. Today, Lilly is a global Fortune 500 pharmaceutical company operating in more than 100 countries. At Lilly, we're committed to bringing life-changing medicines to those who need them, advancing their understanding and management of disease, and supporting communities where we live and work. Since our founding in 1876, we have pioneered medical breakthroughs like human insulin, the polio vaccine, and many other important therapies. We are passionate about building on our legacy to make life better for individuals, communities, and the world around us. Lilly introduced the world's first commercial insulin. We give our best effort to our work, and we put people first, including our employees. Our mission here at Lilly is we make medicines that help people live longer, healthier, and more active lives. And our values are integrity, excellence, and respect for people. Here at Lilly, you will also receive competitive pay, medical and dental plan, on-site service, free health club membership, intentional career planning, and as well as comprehensive retirement planning. And some of the job opportunities that we have here at Lilly in the pharmaceutical industry in the following areas, such as finance, engineering, marketing, market access strategy and analytical, Lilly Research Lab, sales, advanced analytical data sciences, information digital solutions, supply chain. So a lot of opportunities here at Lilly. For marketing, if you decide you want to get a job in marketing, you're interested in opportunities at marketing, in marketing, you will be able to drive marketing business strategy and communicate the value of life-changing medicines to a variety of customers in 120 countries. With the rapid change of the healthcare landscape nowadays, Lilly will need creative marketers to help deliver innovative strategies that change lives. Another opportunity that we have here at Lilly as well is also in the manufacturing core and quality science. In this role, you will be essential in ensuring the high quality production of life-changing medicine and device for patients. In this role, you'll also be building a comprehensive understanding of the pharmaceutical industry and the role scientists play in creating solutions for Lilly. And another role that it's an opportunity here as well is for is the engineering role. And in that role for engineering, you will be joining a value team behind the design, development, and making of medications and delivery devices that possibly impact the lives of patients as Lilly works to bring potential life-changing medicine and new medical devices to market. There has never been a better time right now to join us in their engineering role. At Lilly, They'll invest in your development to grow personally into your career opportunities, and you also have the, as well as the ability to demonstrate leadership in your role as well too. Some other roles that's also available at Lilly currently right now, if you go on to their careers.lilly.com site for some of the engineering roles, and such as process engineering, research scientists, bioinformatic roles available, scientists for bioanalytical roles are available, as well as an engineer role for large biomolecules position is available as well too. So I would encourage you to go on the Lilly career site, look at job opportunities, and look at the basic qualifications. And if you're interested, please apply for those opportunities. The other opportunities that we have here at Lilly is the Community Partners Interview Day. And this is an event for incoming diverse college juniors that provides insight into the pharmaceutical industry in the following area, such as engineering, sales, finance, marketing, human resources, and many other areas as well too. Those opportunities leads into our internship opportunities with Lilly. And the internship opportunity is of 10 to 12 weeks. And it's highly competitive salary, works on big projects. You also get that coaching and mentoring as well, and also organized social event and networking as well too. Here at Lilly, we also have over 11 employee resource groups that represent people from multiple backgrounds, such as, you know, the African American Network, the African Middle East and Central Asia Network, Chinese Cultural Network. Over the past few years, we conduct in-depth research with women and minorities at Lilly. What we learned led us to sharpen our focus on diversity and inclusion and to set new expectations for leaders around inclusion. We measure our progress in diversity. From the end of 2016 to the end of 2018, we increased the number of women in management globally to 42% for racial and ethnic minorities in the United States. And we increased management representation to 21% of total management. 6 of the 14 members of our executive committee are women, and 3 are minorities, including 1 woman of color. On the Lilly board, 4 of our 14 directors are women and 4 are minorities. So I would encourage you to look at opportunities at Lilly, come explore their opportunities that we have here at Lilly. We have great benefits, competitive pay, and a proven record of excellence. If you want to please have the opportunity to learn more about Lilly and the culture and the company, go on to lilly.com's career, and also please follow us as well too in social medias such as Facebook, Twitter, and LinkedIn. And also please connect with me in LinkedIn as well. And I also have my contact information here as well to my email, my phone. If you have additional questions or anything, please feel free to reach out to me. I want to say thank you for being here and taking the time to patiently listen to me share with you about Lilly job opportunities here at Lilly and the employee resource groups. I hope that you now have a better understanding of opportunities that are available for you here at Lilly. It's been a pleasure today talking to you about Lilly and the opportunities and the employee resource groups, and I hope that you will enjoy the rest of your day and the rest of the conference. Thank you. Bye.